a practical guide to making the most of your healthcare visits. Visiting the doctor can be intimidating and often rushed. In fact, a typical primary care appointment lasts only about 15 to 20 minutes, and patients may be interrupted within the first minute of explaining their issues. It's no surprise that many people leave medical visits feeling unheard or confused. The good news is that with a bit of preparation and a proactive approach, you can transform even a short appointment into a productive step toward better health. This guide will walk you through practical tips before, during, and after your healthcare visits so you can feel organized, confident, and in control of your health journey. Remember, your health is a gift, and you have a vital role in stewarding it well. Common pitfalls to avoid. Many visits fall short due to a few common mistakes. Make sure you avoid these pitfalls: going in unprepared, not sharing important information, getting distracted, for example by your phone, not asking questions when you're confused, waiting until the last minute of the visit to bring up a major concern, or failing to follow up on the doctor's instructions afterward. The following steps will help you sidestep these issues and make the most of your time with your healthcare provider. Before your visit, prepare and plan. Taking time to prepare before your appointment can dramatically improve the outcome. Here are steps to ensure you're ready. 1. Keep a health journal. Start a simple health journal to record your symptoms, questions, and concerns as they arise. Note details like when a symptom started, how often it happens, what worsens or improves it, and anything you've tried for relief. For example, you might write, "Migraine, began 2 months ago, occurs to 1x week, usually at night, ibuprofen helps slightly." Bring these notes to your appointment. This written record ensures you don't forget important details when you're face-to-face with your doctor and helps focus the visit on the key issues. 2. List your medications and supplements. Create an up-to-date list of all medications and supplements you take, including prescriptions, over-the-counter drugs, vitamins, and herbal products. Write down the name, dose, and how often you take each item. Don't forget to include any known allergies or past reactions to medications, as well as major past surgeries or medical conditions. It's easy to forget a drug name or a past procedure when you're nervous, so having it all written down is invaluable. Consider bringing the pill bottles or a printed list to show your provider. This is like bringing your medical resume to the appointment. It gives the doctor a clear picture of your background and prevents mistakes. For instance, avoiding drug interactions or duplications. 3. Clarify your goals for the visit. Take a moment to identify why you made this appointment and what you want to accomplish. Are you seeking a diagnosis for new symptoms? Managing a chronic condition? Getting a second opinion? Define your top concerns. Write down a short list of the top 3 questions or issues you absolutely want addressed. Prioritize them in order of importance. For example, 1. Investigate ongoing knee pain. 2. Discuss side effects of new medication. 3. Ask about referral to physical therapy. Having a clear goal ensures that the most pressing matters are discussed early, rather than getting lost in the limited time. Don't assume the provider automatically knows what's bothering you most. Be ready to state it clearly at the start of the visit. 4. Gather relevant records, if any. If you have recent test results, imaging reports, or records from other providers that relate to your current issue, organize them to bring along. For instance, if you recently had blood work or an X-ray through another clinic, bring a copy of the report. This can save time and prevent duplication, and it provides your doctor with more information to work with. Similarly, if you've been monitoring something at home, like blood pressure readings or blood sugar levels, have those logs ready to share. 5. Consider bringing a support person. For important or complex appointments, it can be extremely helpful to bring a trusted friend or family member with you. This person can serve as a second set of ears to remember details, help ask questions you might forget, and provide moral support. They can also help you recall the doctor's instructions later. If you cannot bring someone in person, you may ask if it's okay to have a friend join the call on speakerphone, or even record the visit with the doctor's permission using your phone. Having support will help you feel more confident and ensure nothing important is missed, especially if you're feeling anxious. 6. Take a moment to relax and pray. Right before the visit, take a few deep breaths. It's normal to feel anxious at the doctor's office, called white coat syndrome, but calming your mind will help you think more clearly. Choose to say a prayer for wisdom, clarity, and peace. Even a moment of mindfulness or quiet reflection can be beneficial for you. Approaching the appointment with a calm and positive mindset can significantly impact how you engage with your provider. During your visit, communicate and collaborate. Think of the appointment as a partnership between you and your healthcare provider. You bring crucial information about your body and experiences, and the provider brings medical expertise. Working together as a team is the best way to address your health concerns. Here's how to make the most of those precious minutes during the visit. 1. Share your top concerns first. As the appointment begins, proactively communicate your main reason for being there. Don't wait for the doctor to ask, "What brings you in?" Be ready to clearly and succinctly state your primary concern and goal for the visit, the ones you wrote down. For example, "I'm here because I've had severe knee pain for 2 months, and I'd like to find out what's causing it and how to treat it." Mention the 2 or 3 most important issues you want addressed up front. This helps set the agenda and ensures that you tackle your top priorities early in the visit, rather than running out of time. Remember, if you save a major concern for the very end, oh, by the way, it may not get the attention it needs due to time constraints. Begin by leading with what matters most to you. 2. Be open, honest, and thorough. Provide your doctor with complete and truthful information about your health, even if some details are personal or embarrassing. It's vital not to withhold information. What you don't mention, your provider won't know. Describe all your symptoms, even those you think might not be important or that you're shy to discuss. Additionally, share your lifestyle habits such as diet, exercise, sleep, stress management, supplements, tobacco use, and alcohol consumption, and any home remedies or over-the-counter products you use. Everything you tell the doctor helps them understand the puzzle of your health situation. Honesty leads to better care. Don't make the doctor play detective. Collaborate by putting all the cards on the table. 3. Stay focused and engaged. During the visit, give your full attention to the conversation. Silence your phone and avoid distractions. Maintain eye contact and listen attentively to your healthcare provider. Being engaged not only helps you absorb information more effectively, but it also demonstrates to the provider that you take your health seriously and value their time. Active engagement can lead to a more thorough and respectful dialogue. If you find the discussion veering off topic or you're losing focus, gently steer back to the main issues. "I want to be sure we discuss my knee pain results before we run out of time." By staying present, you make every minute count. 4. Take notes or request a summary. Medical information can be overwhelming, and it's easy to forget details or instructions by the time you get home. Bring a notepad or use a notes app on your phone to jot down important points during the visit. Write down any diagnoses or medical terms so you can look them up later if needed, names of any medications or tests mentioned, and specific instructions the provider gives you, like take this pill in the morning with food, or avoid driving for 24 hours after the procedure. Also note the follow-up plan. For example, return in 2 weeks for follow-up, or call if not improved by Monday. If you're not comfortable taking notes on the spot, you can ask the doctor or nurse for an after-visit summary. Another option, ask if you can record the conversation on your phone. Many providers are okay with this, but always obtain permission first. Having a record of the visit ensures you don't rely solely on memory. Good notes will help you follow the care plan correctly and give you the peace of mind that you didn't miss anything. 5. Ask questions and clarify. Never hesitate to ask questions, whether it's about something you didn't understand or something the doctor just mentioned in passing. Remember, there are no stupid questions when it comes to your health. If medical jargon is used, feel free to say, "Could you explain that in simpler terms?" If you're not clear on how to take a medication or why a test is needed, Ask about it. What is this medication for, and how exactly do I take it? Or, why do I need this blood test? What are we looking for? Use the what, why, how strategy for critical understanding. Ask what your condition or diagnosis is, why the recommended plan is important, and how to carry it out or how it will help you. For example, what do you think is causing my knee pain? Why do you recommend an MRI? How will this treatment improve my condition? Asking questions not only gives you clarity, but also shows the doctor that you are invested in your care. If something doesn't sound right or you have concerns, I'm worried about the side effects of this medication, or is there an alternative treatment? Voice that too. A good provider will appreciate the chance to address your concerns. It's far better to clarify during the visit than to go home uncertain or misinformed. 6. Work as a team with your provider. Approach the interaction as a collaboration. You and your doctor share the same goal, improving your health. Adopting a team mindset means actively participating in discussions and making informed decisions. If the doctor proposes a treatment plan, feel free to discuss your preferences or limitations. For example, if they suggest a medication and you prefer lifestyle changes first, express your preference and explore options together. Or, if you know you won't be able to afford or adhere to a certain therapy, let them know so you can find an alternative. Communication should be two-way. You provide input about what you're experiencing and what you're able to do, and the provider offers expertise and guidance. Again, think of your health issues as a puzzle. You have some pieces, your personal experience, symptoms, and preferences, and the doctor has others: medical knowledge, test results, experience with similar cases. Only by putting both sets of pieces together can you see the full picture and find the best solution. So, engage in the conversation. It's not a lecture to sit through, but a dialogue. Being an active partner in your care leads to more personalized and effective healthcare. 7. Confirm the plan before you leave. Before the appointment ends, make sure you know what comes next. It can help to verbally recap what you understood to ensure nothing is missed. For example, you might say, "Just to confirm, you're recommending I start the new blood pressure medication once daily, get blood work done tomorrow, and schedule a follow-up in 2 weeks. Is that right?" This gives the provider an opportunity to correct any errors or add additional details. Double-check that you know what your diagnosis or working diagnosis is, what treatment is being prescribed, any warning signs to watch for, and what follow-up steps to take, including when to come back or how results will be communicated. If any part of the plan is unclear or seems unrealistic to you, speak up. For instance, if the doctor suggests a diet or exercise change that you're not sure how to do, ask for resources or referrals, like seeing a nutritionist or physical therapist. If a medication is too expensive or you're concerned about being able to take it as directed, let them know and ask about alternative options. It's much easier to address these concerns while you're still there than to discover problems later at home. By confirming the plan, you leave the office with confidence about the next steps. After your visit, follow through for success. The appointment itself is only the beginning. What you do afterward is crucial to getting the full benefit of your healthcare visit. This is where the real progress happens. Use these steps to make sure all that good advice and planning leads to positive action and results. 1. Review your visit. Notes and instructions. On the same day as your appointment, sit down in a quiet moment and go over all the information from the visit. Read the after-visit summary or any paperwork you were given. If you have notes, review them and organize them. Make sure you clearly understand your diagnosis and the details of your treatment plan. For each medication prescribed, do you know how and when to take it and what it's for? For each test ordered, do you know how it will be done and if you need to prepare for it? Write down any terms or instructions that are still unclear and look them up or call the clinic for clarification. For example, if the doctor said you have hypertension and you're not sure what that entails beyond high blood pressure, this is the time to educate yourself with reliable sources. Reviewing everything while it's fresh in your mind will reinforce your understanding and help you identify any areas that may have been missed. 2. Take action within 48 hours. Prompt action is key. There's a principle that if you don't act on a plan within the first day or two, you significantly reduce the chances of following through at all. So make it a goal to implement your doctor's recommendations immediately or at least within 48 hours. This includes scheduling follow-ups or referrals, conducting lab tests or imaging, such as scheduling blood tests or x-rays, and filling prescriptions. For lifestyle changes, take the first step now, even if it's a small one. Acting promptly ensures that the momentum from your doctor's visit leads directly to progress, and it prevents procrastination from derailing your health goals. If anything prevents you from following the plan, such as pharmacy issues, scheduling difficulties, or confusion about instructions, please contact your provider's office for assistance as soon as possible. 3. Track your progress and symptoms. Use your health journal, the one you started before the visit, to monitor how things go after you implement the plan. Note any changes in your symptoms, improving, worsening, or unchanged. If you start a new medication or treatment, write down any side effects or improvements you notice, including the dates. For example, started new inhaler on Monday, felt shaky for an hour after first dose, but breathing easier by day 3. Tracking your progress serves several purposes. It keeps you accountable to the regimen, provides encouragement as you see improvement, or flags issues if you're not making progress, and equips you with detailed information for your next appointment. When you follow up with your doctor, you can report, "I've been taking the medication for 2 weeks. My headaches went from daily to about twice a week now, but I'm experiencing some fatigue in the afternoons." This kind of information helps your provider adjust the plan if needed. Additionally, if you notice a worrisome trend, such as new symptoms or a rapid worsening of your condition, you can catch it early and contact the doctor sooner rather than later. Treat this like a mini science experiment where you're gathering data on what works and what doesn't. You and your doctor can then make informed decisions together at the next check-in. 4. Build healthy habits. One step at a time. Often, a healthcare visit will end with advice to change certain habits, improving your diet, exercising more, reducing stress, or getting better sleep. Embracing these lifestyle changes is essential for long-term health, but it can be overwhelming if you attempt to make all changes at once. Focus on one change at a time to set yourself up for success. Pick one habit to start with and make a concrete plan for it. For example, if you need to exercise more, you might decide, "I'll walk for 20 minutes after dinner on Monday, Wednesday, and Friday this week." Once that becomes routine, you can add another habit, such as adjusting your diet or sleep schedule. Gradual changes are more sustainable and less intimidating, allowing you to identify what's working. It also helps in case something isn't working. If you develop a side effect or new issue, you can more easily pinpoint the cause when you haven't changed 10 things at once. Remember that improving health is a marathon, not a sprint. Small, consistent actions lead to big results over time. Celebrate your progress, even modest improvements, because they indicate you're moving in the right direction. And if you slip up or have a bad week, don't be discouraged. Simply reset and continue forward. Persistence is key. As long as you keep taking small steps, you're making meaningful progress in your health journey. 5. Communicate and ask for support when needed. Just because the appointment is over doesn't mean you can't reach out for help. If questions arise after you've left the office, please contact your healthcare provider. It's far better to ask than to guess or ignore a problem. In some cases, if you feel that despite your best efforts, the visit didn't address your concerns, it's okay to seek a second opinion from another provider. Your health is important. There's wisdom in getting another perspective, especially for serious or unresolved issues. Don't view it as conflict. Good doctors understand and support patients seeking the care they need. Lastly, lean on your support system. Talk to family or friends about your health goals so they can offer encouragement or even join you in making lifestyle changes. If you have a faith community or personal faith, draw strength from prayer and meditation. Ask for perseverance and peace as you work on improving your health. You don't have to do this alone. Involve those who care about you in your journey for accountability and moral support. A 6. Stay positive and committed. A great mindset after the visit is as important as the practical steps. Understand that healing and improvement take time. There may be setbacks or days you feel frustrated. During those times, remind yourself why you're doing this. Perhaps you want to have more energy to play with your kids, or you want to manage your condition to live a long, active life. Keeping the bigger picture in mind will motivate you to stick with the plan even when it's tough. It may also help to remind yourself that by actively participating in your care, you are honoring your own well-being. Every appointment you prepare for, every question you ask, every healthy meal or exercise session, they are investments in you. This positive, proactive attitude is contagious. Providers will often go the extra mile to help a patient who is engaged and earnest about getting better. Give yourself grace too. Nobody is perfect, and changing habits or managing a health condition can be a challenging task. If you stumble, simply refocus and keep going. Persevere. Take heart in the fact that you are taking charge of your health one step at a time. Over time, these efforts can lead to significantly better health outcomes and a stronger, more trusting relationship with your healthcare team. Conclusion. By following these guidelines, you can turn a typically brief medical visit into a truly impactful experience. Preparation, communication, and follow-through are your secret weapons for better healthcare. You'll find that doctors appreciate a prepared and engaged patient, and you'll walk away with more clarity and confidence about your health. Remember, your health is one of your most valuable assets. Taking an active role in your care is well worth the effort. Each visit is not just a task to get through, but an opportunity to learn more about your body and to move closer to sustainable wellness. As you prepare for future appointments, keep this guide handy as a checklist. Over time, these practices will become second nature. You will experience improved outcomes, less stress, and greater satisfaction with your healthcare encounters. Only you can ask questions, make informed decisions, and partner with your providers to achieve the best possible health for yourself. Lastly, know that you are not alone on this journey. Whether it's drawing strength from your faith, your family, or the caring professionals around you, there is support as you strive to be your best. At Aslan Health, we believe that caring for your body, mind, and spirit is a sacred responsibility. When you approach it with intention and wisdom, you are truly making the most of the life you've been given. Here's to more organized visits, better communication, and a healthier you. Your future healthcare appointments can be less stressful, more productive, and health empowering. With each step you take, you are advocating for yourself and transforming your health journey for the better. For your best health. Dr. Mike Hauman, Aslan Health,